Hello and welcome to McLaren Port Huron's Today's Health Program. I'm your host, Michelle Baker. Everyone experiences stress and worry from time to time, but today we're going to talk about how anxiety can impact your health. Joining me is board-certified psychiatrist, Dr. Tom Brozovich. Dr. Brozovich, thank you for joining us today.
Well, thanks for having me, Michelle.
Now let's start with, what is the difference between stress and anxiety?
Yeah, stress I like to think of as we often are aware of what is causing our anxiety. For example, someone may have a big presentation coming up or maybe a big exam coming up, so we're aware of what is causing that stress. When we talk about anxiety, sometimes we lose awareness of what's actually causing that.
Now, everyone experiences stress, but what are the symptoms of anxiety?
Some of the symptoms of anxiety are very several. I mean, there's many presentations of anxiety, and it can present with many physical symptoms actually. Sometimes people will report, I feel dizzy, I feel lightheaded. Sometimes people say I get a choking sensation. Sometimes they feel the symptoms in their heart, like they say I have a pounding heart, my heart is beating fast, or I feel palpitations. Sometimes people report actually like paresthesias, which means like numbness or tingling sensations. They can even describe feeling nauseated or sick to their stomach.
Who is most at risk for developing an anxiety disorder?
Anxiety disorders are actually the most common mental illness affecting, in the US, 40 million people. Some of the disorders are actually more common in females, including panic disorder and generalized anxiety disorder.
Is there any type of genetic predisposition? Does anxiety run in families?
Yeah, those who have a family history of anxiety would also be at increased risk of having an anxiety disorder.
Now, at what point does anxiety impact your life so much that you need to seek treatment?
I think the things to look for if it's really having a significant impact would be if it is starting to affect like your sleeping pattern, if you're not sleeping well, if you're feeling actually really fatigued as well, if you're feeling really tired, because I do find that anxiety can have a draining effect on many people. Also, if it's starting to affect your appetite, if you're not eating, if you're losing weight, these things can have a significant impact on your health and your day-to-day functioning as well.
So basically, if it's impacting your ability to function in your everyday life, it's time to go and get some help.
Yes.
Now, is it common for people who have been diagnosed with depression to also have anxiety?
It is. It's very common. I often see depression and anxiety both together. In fact, of those who have depression, half of those people at least will be diagnosed with an anxiety disorder as well.
Wow. So for those folks who are experiencing a lot of the symptoms of anxiety and they decide to take that step and go get some help for that, should they go to their family doctor or should they seek out a psychiatrist and make an appointment? What's the best way to go?
Yeah, they sure can see their family doctor and discuss the symptoms with them, and often family doctors can also treat anxiety and will start treatment. Sometimes the family physician will begin treatment and then refer to the specialist, the psychiatrist, for further treatment and to also assess the patient and see if any changes need to be made. Also, patients who are suffering from anxiety can call the psychiatrist office directly and start treatment there if they choose to do so. They can also see a counselor to do counseling treatment.
Dr. Brozovich, this is great information. It's time for a break. We'll continue in a moment.
Thank you.